depending on where you are joining us from today. I just wanted to welcome everyone to our implementing self-measured blood pressure program in the clinic setting. This is our 6-week series, so hopefully you can see my screen now that I'm sharing. Okay, seeing some nods. Thanks, Jerry. All right, so this is our first session. So I just wanted to thank everyone for joining today. I'm really glad to have you all and excited to hear from you throughout our session today. We're hoping to make this a really interactive session. Like I said, we're kicking it off today, but throughout our 6-week training, you're going to learn the benefits and techniques for SMBP and how to operationalize them and using at-home measurements in practice. So to get us started for today, and before we dive in, we'll do some introductions and we'll go through some housekeeping items really quickly. I just wanted to let everyone know that all of our sessions are going to be recorded. So we do hope you're able to attend every session, but if not, we will have these sessions recorded for you and available. We also want to make this interactive. We would like to see you. So throughout the session, we'll have some discussions. So if you have a camera and have that capability, we would encourage you to use that and turn that on. And we want to remind you to mute yourself if you're not speaking, and remember to unmute yourself if you do have a question, and state your name when you're participating. So like I said, we want to make this session interactive. So please feel free to jump in at any point if you have any questions or comments, and we can address those as we're moving through our session. So let's do some introductions now to get to know everyone who's participating in our collaborative. So how I will do this is I will call on your name as I see everybody, and I'll just ask you to please unmute yourself, tell us your name, what organization you're from, your title, and why you're interested in participating in our collaborative, or what you're really looking to get out of participating in these sessions. So I will go ahead and start us off. My name is Andrea Boucher. I am a quality improvement advisor with Superior Health, and I am based with Improve Health, which is out of Michigan. So I'm really excited to bring to you some information, whether you are already implementing a self-measured blood pressure program, or if this is brand new information, I'm excited to bring it to all of you. So I will go through my grid, and actually I'll have our Superior Health team introduce themselves first. So Carrie, if you'd like to introduce yourself.
There we go. Hi, my name is Carrie Finley, and I'm a project specialist out of Madison, Wisconsin. I work with an organization called Metastar, which is a part of Superior Health. I am a registered nurse. My background is in nursing, and I'm really excited to be a part of the collaborative today and just to learn about different best practices and the best ways to get self-measured blood pressure programs started. So thank you.
Great. Thanks, Carrie. And Jerry.
And hi, my name is Jerry Henniker, and I am also a quality improvement advisor for Superior Health Quality Alliance. I'm in Minnesota. I work at Stratus Health, which is part of Superior Health. And I'm interested in this because I just think helping people control their hypertension is so, it helps in the management of so many other chronic conditions. And so doing these self-measured blood pressure programs, I think, is a great way to help our patients be empowered and then also to get their hypertension under control.
Great. Thank you, Jerry. And we will be having a guest speaker for today. So Kelly DeLong from the YMCA is joining us. So I want to thank Kelly for presenting for us later today. But Kelly, I'll let you introduce yourself.
Thank you. So I am Kelly DeLong. I am actually not from Superior Health Quality Alliance. I'm from the YMCA. I'm based in Muskegon, so like right here-ish, if you're familiar with the hand. And I'm super interested in participating in this collaborative because while our program is a little bit new, we're always looking for ways to improve, and I love stealing ideas.
Thanks, Kelly. No worries and shamelessly stealing information. All right, so I'm going to go through our participants as I see everyone on the screen. So Tina, I have you first.
Hello, everyone. My name is Tina Schrader, and I am a Quality Innovation Senior Manager with a managed care organization, Inclusa. My base office is the La Crosse area, and I am interested in participating in this collaborative because hypertension is one of the highest number of diagnoses in our member population. We serve over 16,000 members throughout the state of Wisconsin, and hypertension is one of the most highest diagnosed health issue that our members have. So I'm very interested in joining this discussion today. So thank you very much.
Great. Thank you so much, Tina. And Anne, I have you up next.
I think Anne had to step away just a wee bit.
Thank
She
you.
had, left a message in chat.
Great, thanks. All right, Trisha, you are up next.
Thank you.
I believe Trisha also had to step away.
I'm on for right now.
Oh,
I was
okay,
gonna wait till
she's
after. Yep, no, thank you. Well, I didn't leave yet. I was waiting till after introductions. I am Trisha Mayak, also with Inclusa. I know Tina had introduced herself. There's a few of us on today. So I won't repeat the reason while we're here because Tina covered that. So my background is in nursing, but my title at our organization is Director of Quality Innovation. And just to summarize that, for multiple years, I've been involved with the need for us contractually to have a prevention and wellness plan, and that outlines our program that we offer to our members. I think I covered everything.
Yes, you did. Thanks, Trisha.
Thank you.
All right, Stacy, I have you up next.
I am Stacy Mavis. I am also with Inclusa, like Tina and Trisha. I am a member support manager. I support the Mondovi area, which is kind of Eau Claire-ish, for those of you not quite familiar with Wisconsin. So same as Tina and Trisha regarding kind of interest in participating, but then I also have a personal investment as well, in that I'm hoping to try work out a DNP project with Inclusa, hoping under this kind of topic area.
Wonderful. That's great to hear. Thanks, Stacy. All right, and Mary, I have you next. Mary Enright. Oh, see, you're on mute.
Turn my camera on for a minute. But then I'm gonna squeeze my lunch in, so I don't want you to have to watch me eat.
No worries.
Mary Enright, I am with Winona Health, Winona, Minnesota. Oh, I heard Stratus. You're from Minnesota. I think I heard somebody else. I'm a registered nurse and our quality coordinator. I work with a lot of the teams and team leads driving quality initiatives. We certainly could use help on managing our patients' blood pressures, patients with hypertension. We have a large population diagnosed. Our care coordination team focuses on hypertension. So I'm kind of assisting, gathering information, gathering ideas. We've recently invested in 24-hour monitors, digital monitors to give to patients, let them use or keep. Yeah, so I appreciate this work. Look forward to hearing it.
Wonderful. Great. Thank you, Mary.
Yeah.
And Christine, I have you next. Oh, Christine, we're not able to hear you, but I see you're unmuted. All right. Well, Christina, if you want to add you can add your information in chat if that's easier. And then I see we also have Mary Kay joining us if you'd like to introduce yourself.
Hi, I am Mary Kay Cedric, and I'm a Superior Health Quality Alliance.
Great. Thank you, Mary Kay. All right. Well, thank you everyone for introductions. We are certainly looking forward to working with you all over our 6 sessions together. So with that said, I just want to review what a structured collaborative is so that you really have a clear understanding of kind of what to is expected over the coming sessions. So each of our sessions is going to follow this structure that we have outlined here, really just to help guide discussions and outcomes. So our meetings are going to be scheduled once a month to give you some time to complete action plans, and we'll go over our first action plan at the end of this session. So the goal is to really have this same group of participants continuing throughout the series so that you're really provided with all of the information that you need, especially in starting an SMBP program, and also to learn from each other and share best practices. So what our format is going to follow, what it's going to look like, is we start with a welcome. We'll also have polling questions to kick us off. Not during this session, but in our future sessions, we'll have a round robin. So like I said, we'll have those action plans that we'll have you complete in between sessions. So we'll have you share some of those updates on your action plans from our previous session. And then we'll have a didactic presentation and also some time for open discussion and Q&A. And then at the end of each session, we will introduce our action plan for the following session. So this slide highlights what our collaborative schedule is going to look like. So we are going to meet on the second Tuesday of each month, starting obviously this month in January and running through June. Like I said, all of our sessions are going to be recorded. So if you aren't able to make one of these sessions, you will have access to that recording. And we do encourage you also to join us on our Connect platform, and we'll go over that as well at the end of this presentation. But for now, I will go ahead and dive right in for what our objectives are for our session for today. So this will really be an overview of self-measured blood pressure programming, defining what that is, what the benefits are and the uses are for SMBP, and then also talking about eligible patients who would benefit from using SMBP. So to kick us off, we're going to ask you a couple of polling questions. So we'll get those queued up for you, but we really want to hear kind of where you're at in a process for SMBP. So if you've implemented an SMBP program before, so or if you have one currently in place. So I'll give you just a moment to fill that question out. It should have popped up on your screen. All right, and as I'm seeing your answers come in, it looks like there's actually a little bit of almost a 50-50 split between yes and no. So some of you already have an SMBP program established and some of you don't. So I think on either side of that spectrum, I think the information that we're going to share will be helpful. We also have our second question, and we'll get that question pulled up of, do you have an SMBP champion? So what this really means is, you know, someone within your organization who is really responsible for leading SMBP, and someone who is, you know, maybe training others in SMBP. Sorry, I know we're trying to get that polling question pulled up here. I might need to click out of it.
Yep, my apologies. I am trying to get it pulled up here. I'm not sure why it's not working.
I can see if I can launch it, Jerry.
Okay.
Oh, there we go. Okay. So do you have an SMBP champion? So again, someone who's really leading that work, responsible for training maybe new staff or others in SMBP. And I'm seeing kind of a more leaning towards no. So no, many of you don't have an SMBP champion. So we'll be talking a little bit about that throughout our sessions, and really the importance of having that person who is that key driver in leading that in your organization. So thank you so much for filling that out. All right, so I'm going to dive into the background and the purpose of SMBP. So really, before we can understand the purpose of SMBP, it's important to note what hypertension thresholds are. So this chart is reflective of the guidelines put out by the American Heart Association and the American College of Cardiology. So these were most recently updated in 2017. So classifying that hypertension, stage 1 is starting at 130 to 139 for systolic and 80 to 89 for diastolic. So just wanted to point that out, that if the blood pressure does stay higher over time, you know, we really want to make sure that patients are being able to manage that blood pressure at home at that appropriate threshold. So what is SMBP? SMBP refers to the regular measurement of blood pressure by a patient, either at their home or really just anywhere outside of a clinical setting. And it's really helpful to allow physicians to better diagnose and to manage hypertension, and also allows patients to have that active role in their healthcare and in the process of managing their hypertension. So as part of SMBP, a patient receives training from their clinical team on how to properly self-measure. So this can be done, it doesn't have to be super lengthy. It can actually be about 5 to 6 minutes of training by a nurse or a medical assistant, or the physician can train the patient, teaching them how to prepare to measure, what the proper positioning should be, and other instructions on how to capture their blood pressure and report those readings back. So the patients should share their blood pressure readings with their healthcare provider. There are multiple ways that patients can do this, and we'll cover that in a few of these sessions. But those SMBP readings that are shared back with the provider are really what's used for either the diagnosis or the management of hypertension. So patients who might not have an existing diagnosis of hypertension, who have an SMBP average of greater than or equal to 130/80, that stage 1 threshold that I just mentioned, do meet the criteria for hypertension. So previously diagnosed patients, if they have that diagnosis, they are considered uncontrolled if their blood pressure is at or above that 130/80 threshold. So really, a patient with an SMBP average that's greater than or equal to 135/85 has stage 2 hypertension. So as these readings are being reported back to the clinical team after they are interpreted, that feedback to the patient and that clinical support needs to be provided. That's another key component of what's needed in SMBP. And clinical support could be one-to-one counseling, it could be web-based, or it could be telephonic support. It could be tools and access to educational classes. So those are some examples of that. So this is just a really great infographic on a visual representation of what SMBP is, starting with the patient measuring their own blood pressure at home. So they use their own personal SMBP device, or one that could be provided to them, and they measure their blood pressure. Those readings are then relayed to the provider either through Bluetooth capabilities, through the blood pressure device, or maybe a tracking log that the patient is keeping tabs on, and that information is included in the patient's medical record. So implementing SMBP, again, along with that clinical support, one-to-one counseling, educational classes, that is really an evidence-based and a proven approach to reducing the risk of disability or death due to hypertension. It can improve access to care for many patients and really the quality of care for people who are living with hypertension, while making blood pressure control, it can be more convenient for patients to measure their blood pressure at home, and also increasing access across a large population. So why implement SMBP in your practice? There's really obviously a lot of national data that demonstrates the importance of adopting SMBP, especially at the local level. High blood pressure is a contributing factor to major health conditions like heart attack, heart failure, stroke, kidney failure. And nearly 1/3 of American adults are hypertensive, and half of those individuals are not in control. So really, again, there's a lot of statistics that show that SMBP can be a useful tool in managing hypertension. So this slide is a great resource for patient education materials on the importance of blood pressure control and the benefits of SMBP. If you're not familiar with the Target BP program, I would definitely recommend checking out their website. We do have a link on this slide to some of these tools, but they have a lot of great resources, patient-facing materials, and also provider-facing materials that you can use as part of an SMBP program. So I just wanted to take a second to mention those. But what I'll be going through next are the benefits of SMBP. There are obviously a lot of benefits to patients completing this since the measurements are taken in the patient's usual environment. So it's giving a provider multiple blood pressure readings that are over a longer period of time. So it's definitely more representative of what a patient's true blood pressure might be. It also helps to give a more timely and a precise initial diagnosis of hypertension. Again, if SMBP is being used to make that diagnosis, those out-of-office blood pressure measurements are recommended to confirm a diagnosis because a significant number of patients have different blood pressures outside of the office as compared to when they're in the office. And it also helps to give a reliable estimate on the effectiveness of antihypertensive medication treatments. So if a patient is diagnosed, it gives a better picture over whether maybe some medication titration might be needed or an adjustment of a patient's medication. It also helps to confirm elevated office readings, again, using those thresholds that I outlined on a previous slide. And it also differentiates between white coat and sustained hypertension. So white coat hypertension is when people have a high blood pressure in the office, but they do not have high blood pressure when they're at home or in another setting outside of the office. It also detects masked hypertension. So masked hypertension is when people with non-hypertensive blood pressures in the office have high blood pressures when they're measured at home. So that one's a little more difficult to catch those patients, and that's why SMBP is really important. So again, some additional benefits of SMBP, a better understanding of the patient's medication needs, whether the patient is using a medication appropriately, if the dosage is correct for that patient. It's really helpful to determine if the medication, if it's taken as prescribed and taken correctly, is appropriate. It also helps to assess the control of blood pressure at different times. Again, it could be across, a 24-hour period, since the patient is measuring outside of what, normal physician office hours might be. It's helpful to get that better picture of what their blood pressure might be in the early morning or, in the evening after dinner. And also it's helpful to decrease resistance to treatment. So again, SMBP is really empowering for patients. It's helpful to get them more involved in their care and to self-manage. And patients who do engage in SMBP could be more likely to take action and to do those things to improve their health in other ways. Again, also improving access for those with barriers related to receiving healthcare. If patients aren't able to physically get to an appointment, but they have a device at home, they're able to capture what their blood pressure is. There's also been studies that show that there's improvements in both systolic and diastolic, and then also mean blood pressure. One study I do want to point out in a patient trial that home monitoring plus the self-titration of medication and telemonitoring cut an average of 12.9 millimeters of mercury off of their systolic blood pressures on average. So next we'll go into what patients benefit from SMBP. So first, obviously, patients with a diagnosis of hypertension benefit as they become more engaged in their own care. It can improve their medication adherence and ultimately improve their blood pressure control. For these patients, it also gives the provider a look into how effective that treatment is that they're prescribing for the patient and allows for that medication adjustment if needed. It also is helpful in assessing the effect of the treatment on blood pressure protocol. Again, the titration of antihypertensive medications, but also the non-pharmacological therapies that might be needed or recommended for each patient. It's also helpful in determining whether there is treatment-resistant hypertension present if a patient is, taking their medications appropriately and following their treatment plan. If there is a blood pressure that is difficult to control, it's easier to identify that. And then also, it doesn't just have to be patients with a diagnosis of hypertension that can benefit from SMBP. It can also benefit patients with those elevated office blood pressures who might be suspected of having hypertension. And again, this is used to make a diagnosis. So with those patients with suspected white coat hypertension, where people are exhibiting that blood pressure level above normal, maybe it's due to anxiety or another issue if they're sick or whatnot. If that's experienced in the clinical setting, that's helpful to find that. And then also if the patient's experiencing masked hypertension, that's kind of like the opposite of the white coat, where the blood pressure reading is within normal range in the clinical setting, but higher at home. So this slide outlines, where you would want to see the range for systolic and diastolic blood pressures for both white coat and masked hypertension. And then lastly, which patients benefit from SMBP? The patients with uncontrolled hypertension is really useful for SMBP to help those high-risk patients to achieve blood pressure control. If a patient is newly diagnosed with hypertension, and by this, it's kind of defined as diagnosed within the last 6 months, SMBP can be used to engage with those patients to help titrate medications, especially for those newly diagnosed patients. And then patients with a potential undiagnosed hypertension. So SMBP here can be used to improve that timely and accurate hypertension diagnosis, again, ruling out those white coat effects, and also the hypertension patients with medication adherence challenges. So in this case, SMBP can be used to engage, help titrate medications for patients with hypertension who have maybe some barriers to adhering to their medication and their treatment plan. And then lastly, hypertension patients with office visit barriers. Again, SMBP can be used to engage with those patients. Maybe they are better served outside of the clinic, where they just need that access at home to measure their blood pressure. And one last thing I wanted to point out before I open it up for any questions are the CPT codes that are available for SMBP. And we'll do a little bit of a deeper dive into these in one of our future sessions, but wanted to put this information out there if you're not using them already. There are 2 different codes for SMBP. The first one to be used for that initial education. So providing the patient the information that they need to understand SMBP, validating their device, so making sure that it's working appropriately. And then the second code is for the ongoing monitoring. So that'll be for you can use it once a month for each patient if they're providing the readings back to you. And again, like I said, we'll do a little bit of a deeper dive into this at a future session. So I'll go ahead and I'll pause for a minute and see if there are any questions on any of the information that I have shared today.
If you have any questions, you can put it in chat or just take yourself off mute to ask.
Thanks, Sherry. All right, well, not hearing any questions, I'm going to turn it over to our guest speaker for today. So we are so grateful to Kelly from the Michigan YMCA to share her experience with us on their blood pressure program. So Kelly, I will go ahead and I'll turn the floor over to you.
Thank you. Thank you. And I do want this to be interactive because I'm one of those people that if I don't ask my question right away, I kind of forget about it. So please interrupt or I'm sorry, Jerry, just put it in the chat, whatever that looks like for you. So let's get going here. I'm talking to you about our blood pressure self-monitoring program. I know that ours is BPSM and we're talking about SMBP. But we'll just talk about what our program looks like, who it is that we work with, how we recruit, and that sustainability piece of that. And I just wanted to mention that we were all set to go at the end of 2018, beginning of 2019, and then the pandemic hit and this kind of took a back seat. And only just at last year, we kind of revived this program again. So a little bit about the program overview. The first thing that I always mention is that We talk about this program being evidence-based to our partners. It helps them to understand this program has developed based on the best research and has been tested for proven outcomes time and time again. We want to demonstrate that program integrity and that we deliver the program as intended and that we deliver those intended outcomes, just to kind of build that trust in our partners and our participants. Personalized support. We know that most people typically know what they need to do to get their health back on track. They just don't do it. So instead of that finger pointer that clinicians typically get to do, we get to be the hand holder as a community organization, which is a luxury that many of healthcare providers simply don't have the time for. This program is delivered by a Healthy Heart ambassador who is trained through the YMCA of the USA. And that training includes HIPAA compliance and motivational interviewing. Our Healthy Heart ambassador makes the participants feel welcome, understood, and can be available when needed. This is a 16-week program, so it's just 4 months long, and we ask each participant to come to 2 office hours a month, where they'll monitor their blood pressure in front of the coach, and then we ask that they track on their own on the weeks that they don't actually see their coach. We know that people are busy, and we offer both in-person as well as virtual office hours. We hold 1 a week, ensuring that we hit each day of the week at different times. So we always offer a morning, afternoon, and an evening option for convenient scheduling times for our participants. So we have 5 main goals of our program. The first one is obviously a reduction in blood pressure by identifying patterns and trends on which to take action. The second is to better manage their blood pressure over time by better developing the habit of self-monitoring, because we know that once they start to do it, obviously they'll continue to do so. Third is increase awareness of triggers that elevate blood pressure. They're given little pocket cards that show tips for better self-monitoring, including like best posture and, having an empty bladder while you take your blood pressure. Fourth is improving the knowledge of healthy heart eating habits. More about that on the next slide. And the fifth is enriching communication with healthcare providers by sharing self-monitoring results. So again, we get to be the hand holders and they get to show off their hard-earned results with their care providers. Nutrition component, we know that nutrition is a large component of heart health, and we wanted to be sure to offer a nutrition seminar every single month. It's led by a registered dietitian, and she walks participants through a shared PowerPoint and answers questions in real time. So you can go to the next slide. It's just a screenshot of our series. So the 4 topics that we cover in our nutrition seminars, the first is dietary approach to stopping hypertension, so that DASH diet. The second is reducing sodium intake. Third is shopping, prepping, and cooking for better blood pressure management. And fourth is heart healthy eating for life. We just run these on a loop, so no matter when a participant is entering the program, they're able to access all 4 of those seminars, just in a little bit different order from the people previous to them. This particular series is offered via Zoom with plenty of time built in for Q&A, which is really a huge benefit for those participants because they get one-on-one time with a registered dietitian. Next slide. This talks about who we work with and the recruiting aspect of it. We've only offered this program for less than a year, but we have gotten our feet under us and we're up and running. This program is offered to the general public. You can see on the left there. In order to qualify, participants need to be at least 18 or older, because again, this is evidence-based, have been diagnosed with hypertension, and then not have experienced a recent cardiac event, AFib or other arrhythmias, or be at risk for lymphedema. On the other side of that, we also work with healthcare providers, but for referrals, but also with the understanding that those referrals are bidirectional. So we know that a variety of things can pop up in the 4 months that we are working with them, and we want that line of communication to be open. It's important to note that we deploy a feedback loop in which we're always communicating with those providers to let them know that, maybe we received their referral, if we're able to schedule that referral once they complete the program, or if we couldn't reach them, or if they're just not interested in participating. Oftentimes that high blood pressure comes with friends such as obesity. So it's important to have those wraparound services needed. So maybe we can offer them another community programming like diabetes prevention program type of thing, or if they're worried about maybe their heat being shut off, that we can kind of have those wraparound services prepared and ready to go. So those are kind of some of those safety net resources so that they can get those immediate needs taken care of and continue to focus on the goal at hand with our blood pressure program. And then lastly, we've started working with insurance providers because we know that we have to look ahead. Some insurance providers have helped us with recruitment by sending bulk outreach to their members that qualify, indicating, hey, you've been identified with hypertension. We have a partner in the YMCA that offers this program at no cost. Call them if you're interested. We've also gotten some grant funding from payers to help with sustainability, which is definitely on the next slide as well. So I just wanted to highlight these 3 facts. I know that we all are painfully aware of them, but it just really drives that point home. So 1 in 3 adults has high blood pressure. Only 50% know it. And that high blood pressure contributes to or causes more than 1,000 deaths each day in the US. So that's why this work is so important. It's important that we retain the participants who enroll. And it's also important that we do the work now to ensure that the program doesn't go away when grant dollars do. There's nothing worse than, building this huge referral network and having all these people come and then grant dollars dry up and you say, sorry, so sad, too bad. For the better retention, we do deploy a social determinants of health screening tool to capture any participants that have had a social need and would like help so they can get back to focusing on their health. We rely heavily on community partners such as the Health Project here locally to carry out those referrals. So that's when we would refer any kind of social need. We do our best to anticipate and eliminate any potential barriers ahead of time, such as transportation issues. We do offer this virtually if they'd like that option as well. The cost of a participant joining. So again, we offer it at no cost because we do fundraising and approach those corporate and community partners, as well as if they need a blood pressure cuff or maybe some childcare to kind of carry out and go to their office hours. Lastly, we work hard to recruit participants and provide a quality program so that our healthcare, community, and insurance providers all want to continue to work with us. Funding is definitely that looming presence that we know we need to crack sooner rather than later. So when you mentioned the CPT codes, my eyes lit up like, okay, I need to pay attention to this part. We right now are working kind of a braided model in which we have a healthy mix of insurance reimbursement, support from local corporations, as well as include this program in our kind of annual fundraising efforts, just to make sure that this is something that we can sustain and offer at no cost to anyone that needs it, so that they're getting the help that they need in a timely manner. I think one of our legs up is that we are a community organization, that we don't have to do this, in a clinical setting, and that's appealing to some because we don't have kind of that white coat hypertension that you mentioned earlier. This program is appealing to a lot of people, but we've done a lot of work in making sure that our retention is where we want it to be and that we are delivering a quality program. So I just threw a lot of information at you. I can take any questions if you'd like.
Great, thanks so much, Kelly. And if anyone has a question, feel free to either put it in chat or you can unmute and jump in.
I have a question. This is Carrie. Oh, and I see there's one in chat too. But my question was what does the handoff look like at the end of the 6 weeks with the practices to maintain the sustainability?
Definitely. So I didn't take a snapshot of it, but what we have is called just a feedback loop. So when we receive a referral, we're kind of constantly in communication with that provider. When they do complete the program, we just send a snapshot of progress. They attended X amount of office hours, they attended X amount of nutrition seminars. This was their baseline and here's where they're currently at. So that, like I said, we have the luxury of spending the time with participants, and clinicians might not have that luxury. And so with that handoff and sending that, we typically do secure fax so that it goes right into their electronic medical record, so that when they're in the office, the provider can pull that up and chat about it right then and there. Good question. And
I'm seeing the other question in chat, how many people are in the program?
Grand total of only 26 so far. One thing that I did not mention is that when the pandemic hit, we took a couple of years because we thought this was just going to be really quick, right? But realized that we need to just get up and running. 26 is better than none. I love it. We took it upon ourselves to contract with all the Ys in the state of Michigan to be their sole provider of this program, so that way, with it being virtual, we could take people from all over the state instead of just having little satellite hubs and making the burden of the administration better for a lot of the other YMCAs. So we're just now starting to get our feet underneath us, and building referrals across the state instead of just locally has been a little bit challenging.
Thanks, Kelly. I do have a question. So I know, Kelly, you are based in Michigan. Do you know if this program is currently happening in Minnesota and Wisconsin in our partner states?
Yes, so I do know that this is a national program for the YMCA. It's one of our 6 evidence-based. And offline, I can get you a list of YMCAs in those states that are currently delivering the program.
That would be great. Thanks so much.
Sure.
All right. Are there any other questions for Kelly? Okay, well, hearing and seeing none, I just want to thank you so much, Kelly, for your time today and sharing your program with us. I think it's a great opportunity for, I know we have many physician offices joining us on these sessions, so a great opportunity to maybe connect, and as a referral program, I think that's a great opportunity for the patients.
Thank you.
All right, so our next portion of today really want to focus on that action planning that I had mentioned at the beginning of our session. So each week we are going to have what we're going to say is homework. I don't want that to sound scary for you all, but we're going to give you a homework assignment to do between now and our next session. So what we have for these after this first session is to designate some clinic champions, whether that's 1 or 2 people within your organization, to really be that main point of contact, that person who can really drive your SMBP program, providing information to other team members as needed, being that go-to person that could answer any questions about SMBP, just to be that person in case there is any turnover in your staff. We do recommend having typically 2 people to be your SMBP champions. So going back into your organization and seeing who those people might be. And then also who you're targeting for SMBP. I went over today all those different types of patients that can benefit from SMBP. So maybe there's a specific population of your patients that you want to look at. Maybe it's your patients who have uncontrolled hypertension. Maybe you want to target those patients who are newly diagnosed. So again, looking within that last 6 months, are those the patients you want to focus on? Or maybe it's capturing patients who don't have that hypertension diagnosis yet, but you might suspect they could be hypertensive and they have maybe that white coat or masked hypertension. Maybe looking at patients with those barriers to access for healthcare. Maybe that's the population you want to look at, or if there's any other ideas that you have around a specific population to look at. So outlining who that might be, who you want to target for your SMBP program. And then if you have the capability, if you have time before our next session next month, to get that list of patients and to pull those patients to identify who might be eligible for your SMBP program. So that could help you to get a good start on who you might want to refer and when those patients are going to be coming in next to get them enrolled in an SMBP program. So this is what our action planning document looks like. So this will be available, and Carrie just put our link to that in the chat. So the link includes all of the kind of homework assignments that we have for you for each session. But again, we can just be focusing on this first session. If you want to look ahead, you can feel free to kind of see what's next. But that is what we will be talking about over the next month. So if you do have any questions, you can always feel free to reach out to us. I do want to mention that we will be having a specific area in our Superior Health Connect platform that you can join specifically to this SMBP collaborative. So it'll be this private group, and we'll be sharing all of our presentation materials and other resources in there for you. So you can feel free to connect with each other, ask questions, and share your own resources if you have any that you would like to share around SMBP. We'll also put the action planning document in there as well, so you can always see what is to come as far as your homework assignments in between sessions. So with that, I will open it up for any questions, any comments you have regarding SMBP. I'll open it up for discussion. And Carrie just dropped our link to our private group in the chat, so feel free to go ahead and click on that and join us today. Again, all of our presentation materials or resources shared today will be available on there.
Does my mic work today?
Oh, I can hear you, Shayna. Go ahead.
Okay. I had problems last time. I think this is great. I think the hardest part that we have at our clinic for just blood pressures in general is providers coming up with the same, I don't want to say algorithm, because one provider just wants one blood pressure, one wants 12 blood pressures, one will just take 3 and will average them. So we hear so many mixed reviews about, blood pressures, and, also to try to get the patients to write down when they're taking their medications compared to when they're actually taking their blood pressure, or what was kind of to journal more or less kind of thing. But so this is good. I kind of sit back and listen to most of these and talk a lot too. Even though I don't see patients, I do more of the clinical build for things. But it gives me ideas because I'm on a lot of our work groups to pass on to other entities in our setting for OMC. But the YMCA stuff is great. I mean, ours closed in Rochester, so to just think that there's other YMCAs out there that are still thriving is good.
Yeah, that's great. No, thank you so much for speaking up, Shayna. I think I might have missed you in introductions. Can you let us know what organization you're from?
I'm from OMC Medical Center in Rochester, the other medical facility in Rochester. I joined late, way late, because I had another conflict, and I was like, oh, it finished early, I'm going to join. So.
Well, perfect. Well, glad you can join us. And yeah, definitely hear you on, the need for standardized protocols for clinicians. It's definitely, I think a sticking point for many that physicians kind of want to do what they want to do, their own kind of protocol, but having that standardized across the board in your practice is definitely key to making sure, especially if patients are kind of bouncing around in between clinicians, what their actual blood pressure is. So if you do need any help or any, protocol templates or anything like that, you can feel free. We can always help with something like that too.
Yeah, I appreciate that. Thanks.
Yeah. All right. Any other questions or comments for today? Okay. Well, there's been lots of information shared with you in the chat for today. We have our links to today's presentation. If you do have any questions in between our sessions, you can feel free to reach out to us. Jerry put all of our emails in the chat, but we'll also be available, like I said, in the Connect platform for you to ask any questions in there. And we do have our link to our feedback form for today that Carrie just put in the chat. So we'd love to hear from you and use the information you share in there to help improve our future sessions. So feel free to take a moment to fill that out. But I just want to thank you all for taking the time to spend with us today. And we're really looking forward to our next 5 sessions with you. Carrie or Jerry, do either of you have anything you want to share before we sign off?
I just want to say I'm excited to looking forward to our next 5 sessions. And, one thing too, we had Kelly present today about what their, SMBP program looks like. If there's anyone who wants to present on a future session, and it's really easy, I don't want to, I know that sounds like, oh, now we're asking you to present, but just kind of give like a quick 5 to 10, like this is what we're doing kind of thing. Because again, this is the opportunity to learn from each other. So if anybody has something that they'd like to present on at our next session on February 7th, just reach out to either Carrie, Andrea, or myself, and we'll help you get everything set up. It's not, I don't want you to feel like you have to put together this big PowerPoint presentation. It's more just kind of like sharing so that we can learn from each other.
Yeah, and I just wanted to share, I know I put a lot of links in the chat. I apologize for that. Don't feel like you need to scramble to capture all of those. They were just there for you. If you needed them, we'll make sure to have them, like Andrea said, on the Superior Health Connect in our group, and we can also send out a follow-up email as well if that would be helpful. So you really want to make sure that you receive the materials.
Great. Well, thank you both. And thank you everyone so much for joining us today. And we look forward to seeing you at our next session.